So, Zhao, how can the health sector effectively reduce its energy consumption and carbon emissions?
So in addressing the carbon emission and energy consumption, health sector, particularly the hospitals, they are really responsible for doing something different in terms of the technology innovation and procedure management and all the leadership building. And I think hospitals need to recognize the importance of addressing these issues by connecting the medical services and the health impact of their consumptions of medical products and also energy use. So I think it's a turn point for hospitals in China to put their operations and the strategy in the context of the global climate change policy regime. They need to work with all other players in this field, from industries, from policymakers, from non-government NGOs and civil society organizations to make collective efforts to find the ways of reducing the environment and the carbon footprints of the operations in hospitals.
Okay, so what do you think about the climate smart concept in terms of the Chinese context?
Yeah, the climate smart healthcare proposed by the World Bank is a systematic shift of the thinking on the healthcare service. I think it's a good start point for health sector as well as other relevant sectors to combine their thinking together to rethink the role that health sector should be playing in the future's decision making of global warming, climate change, and also energy transition. So this framework is a really useful tool for people in health sector and other sector like development institutions, like economic institutions, to refresh. I mean, to get their thinking refreshed and find really changing system puts the health in the very central position of the policy making and to make changes collectively.
Okay, so what do you think the transparency issue in the health sector? What's the role of having more transparency in
It's
the
a
Chinese health
it's a
sector?
big challenge for most of countries, and because data access is a start point and it's essential to make quality policies. And I think health sector, hospitals, and the suppliers, manufacturers, they are responsible for providing more data to the field and to all players in order to involve with all stakeholders and build up more effective policy changes which should be based on the data and evidences. So that in that regard, I think transparency is not about the business of the civil society organizations, but also for government agencies, industry players, and also hospital operators.
Great, thank you, John.
Thank you very much.